Most people think stomach cancer announces itself loudly, sharp pain, dramatic symptoms, some unmistakable emergency, but that is not how it often begins. In many people, it starts quietly, like a whisper in the body. A little burning after meals, feeling full too quickly, a strange nausea you blame on stress or bad food. And that is exactly what makes it dangerous, because by the time severe pain arrives, the disease may already be far advanced. I want you to imagine something for a moment. Your stomach is supposed to be one of the most resilient organs in your body. Every single day, it handles acid strong enough to break down food, bacteria, irritation, and stress. It is built like a furnace. But when something begins to grow there that does not belong, the early warning signs are often subtle, almost polite, and too many people brush them aside. I'm Dr. Michael, and for nearly 2 decades, I've seen how small daily habits quietly turn into life-threatening conditions. The scary part is, most people never notice the warning signs. People come into clinic wishing they had paid attention sooner, not because they ignored huge symptoms, but because they ignored small symptoms that quietly stayed too long. So today, I want to walk you through the warning signs of stomach cancer you should never casually dismiss. Not to scare you, but to arm you with awareness. Because early detection can completely change someone's future. And there is one symptom in particular that surprises almost everyone. We'll get to that shortly. Let's begin with the first warning sign: persistent burning sensation, or indigestion. Now, occasionally getting acidity after a heavy meal is common. Spicy food, oily food, late-night eating, stress, all of these can irritate the stomach temporarily. But stomach cancer has a dangerous talent. It can disguise itself as ordinary indigestion. That is why some people spend months treating themselves with over-the-counter antacids, while the real problem quietly grows underneath. Here is what concerns me medically. If you have burning in the upper abdomen, persistent discomfort, bloating, or indigestion lasting for weeks or months, especially if medicines barely help, your body may be signaling that something deeper is happening. Biologically, a growing tumor can inflame the stomach lining and interfere with normal digestion. Emotionally, people often normalize the discomfort because life is busy. Practically, it may start affecting your meals, sleep, and daily energy without you fully realizing it. And this is where many people lose valuable time. Now, the second sign is one people rarely connect to stomach cancer: feeling full unusually quickly. This is called early satiety. Maybe you used to comfortably finish a full dinner. Now, halfway through the meal, your stomach suddenly feels heavy, tight, uncomfortable. At first, it seems harmless. You may even think, maybe I'm just eating healthier. But when this keeps happening repeatedly, your stomach may be struggling to expand normally. And here's why. As a tumor grows, it can physically reduce the stomach's capacity. Imagine trying to fill a backpack that already has a heavy object stuck inside it. There's simply less room. Food also starts sitting in the stomach longer because normal muscle contractions become disrupted. Digestion slows down. Pressure builds. The stomach sends a message to the brain saying, "Stop eating." What makes this symptom so deceptive is that many people actually feel proud of eating less, until weakness and weight loss quietly begin appearing beside it. And that brings us to the third warning sign: unexplained weight loss. This is one of the body's loudest silent alarms. I say silent because the weight often disappears gradually. A few pounds here, a shirt fitting looser there, someone telling you your face looks thinner, but you were not trying to lose weight. Cancer changes metabolism in deeply aggressive ways. The body begins burning energy inefficiently. Appetite drops. Digestion weakens. Nutrients are not absorbed properly. And psychologically, this can become exhausting. Food stops feeling enjoyable. Eating becomes work. The body feels drained even after resting. Many patients describe it like this: "It felt like my body was slowly unplugging itself." That sentence has stayed with me for years. And there is another symptom that often appears alongside this one: persistent nausea, not occasional nausea after spoiled food, not motion sickness. I'm talking about that lingering, unsettled feeling, the sensation that your stomach is constantly off. Sometimes people feel nauseated every morning. Sometimes they feel food sitting heavily for hours. Others start vomiting intermittently. As stomach cancer grows, it can partially block how food and liquids leave the stomach. Imagine traffic slowly building inside a tunnel with nowhere to go. Pressure rises, the stomach stretches, nausea follows. In advanced cases, vomiting becomes more frequent because the stomach physically struggles to empty itself. This is why persistent nausea should never be casually ignored when it continues for weeks, especially when it appears together with fullness, indigestion, or weight loss. Now, before I share the next warning sign, I want to pause for 1 second because this information genuinely matters. If you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about because the right information can change someone's life. And honestly, sometimes one video reaches one person at exactly the right moment. Now, the next symptom is one of the most important warning signs of internal stomach bleeding. Black stools. This is not normal dark stool from food. This looks black and sticky, almost like road tar. And here is what is happening internally. When bleeding occurs inside the stomach, the blood gets digested as it travels through the intestines. By the time it exits the body, it becomes black. Sometimes the bleeding is slow and intermittent, which makes it easy to miss. But over time, the blood count begins dropping. Patients may feel weak, dizzy, breathless climbing stairs, exhausted during normal daily tasks, and many people think they are just getting older. But low iron or anemia without explanation should always be investigated properly. Now here is something extremely important most people misunderstand about stomach cancer. They wait for severe abdominal pain, but severe pain often comes later. That surprises many people. People assume no pain means no serious problem. Unfortunately, that is not always true. Early stomach cancer can be disturbingly quiet, which is why awareness matters so much. Your body often whispers before it screams, and those whispers are what save lives. Persistent indigestion, feeling full quickly, unexplained weight loss, nausea, black stools. These symptoms do not automatically mean cancer. Many conditions can cause them, including gastritis or ulcers. But if symptoms persist, repeat, or progressively worsen over weeks and months, please do not ignore them. One conversation with a gastroenterologist can bring clarity. Sometimes all it takes is a simple consultation, blood work, or an endoscopy to rule out something serious early. And early changes everything, because when stomach cancer is detected early, treatment options become dramatically better. Outcomes improve, lives are saved, families stay whole. I know health anxiety can be frightening. Many people avoid testing because they fear what they might hear. But uncertainty is often more dangerous than truth. Your body is not your enemy. Symptoms are not betrayals. They are signals, and listening early can protect your future. So if you have been brushing aside persistent stomach symptoms, let this video be your sign to stop postponing your health. Small actions now can protect years of your life later. And remember this, getting checked is not weakness. It is wisdom. Thank you so much for watching. And before you go, I'd love to hear from you in the comments. Where are you watching from? Please like the video, subscribe to the channel, and share this with someone who may need this information today. Take care of your stomach. Take care of your health. And most importantly, do not ignore what your body has been trying to tell you. Because small changes, early awareness, and timely action can bring something incredibly valuable back into a person's life. Comfort, freedom, and peace of mind.